Good day, everybody. Welcome to the third episode of our mini series here at Plan A podcast with regards to mental health. We are doing these in support of the Bell Let's Talk mental health initiative that is going on annually to raise funds for mental health causes across Canada. So we wanted to take some time out in order to speak to some really important issues here. I'm joined by my colleagues James, Sarah, and Nikki. We're quite pleased to be here today to discuss dementia as the next topic in our ongoing little mini series here. So really want to get right into it. Dementia is a decline in cognitive function. To be considered dementia, mental impairment must affect at least two brain functions. These include memory, thinking, language, judgment, or behavior. In my past experiences, I have worked directly with residents and individuals in long-term care and retirement homes with dementia. I was very fortunate early on in my career to be hired into a management position right out of university under the tutelage of a dementia and Alzheimer's expert in long-term care. So my very first manager or administrator in the facility was a published author on the subject as well, had put on a ton of educational conferences and been keynote speakers across the board in various locations around North America on the subject, and was very fortunate to spend several years working under his wing and really developing an affinity for individuals with Alzheimer's and dementia. Just the array of ways that this affliction can present itself is baffling, and it certainly keeps you on your toes. It can manifest itself in a number of different ways, both positive and negative, with regards to aggressive behaviors and things of that nature. So lots of interesting information to share with you throughout this episode, and really looking forward to have an opportunity to share this with you. There will be links and resources provided on screen for you as we work through our conversation. So if you or anyone around you is showing signs of dementia, or you feel like you may need some support with regards to resources, please feel free to reach out to anybody that we've linked on the page, as well as to Plan A ourselves. We'll be happy to lend support to you in any way that we possibly can.
Dementia is not a disease. It may be caused by a variety of illness or injuries. Mental impairment may range from mild to severe. Dementia is degenerative, meaning that sadly it progresses over time.
There's lots of different symptoms that are linked with dementia, some of which are obviously quite common that people will know about. Others are a little less common. There's lots of different things, such as not coping well with change, subtle changes in their short-term memory, reaching for the right words, being repetitive. I know I shared on a previous podcast that I had a great aunt who was going through dementia, and it was the same conversation over and over and over again. They can have a confused sense of direction. I know somebody who one day was calling to say he got lost on his way home from work, and he'd worked in the same place for 35 years. That was his daily drive twice a day. All of a sudden, he just had no idea how to get home. They can struggle to follow storylines. There can be changes in moods. There can be a loss of interest in a lot of different things, obviously confusion, and difficulty completing everyday tasks. The typical sign is memory loss. However, somebody that has memory loss, it doesn't necessarily mean that they have dementia, because there are a number of things that can affect the memory.
There are different stages of dementia, from mild to moderate to severe. There are many causes of dementia, but in general, dementia results from the degeneration of neurons. It can also be caused by other diseases, including diseases of the brain. It's a neurodegenerative disease, which means that neurons gradually cease to function. Dementia can also be caused by metabolic disorders like B12 deficiency and kidney and liver disorders.
People often confuse Alzheimer's disease with dementia, but Alzheimer's is actually a form of dementia. There is Alzheimer's disease, vascular dementia, Lewy body dementia, Parkinson's disease, and frontotemporal dementia. Alzheimer's is the most common and accounts for between 60 to 80% of all dementia cases.
Vascular dementia is caused by reduced blood flow in the brain, either through plaque buildup in the arteries or from a stroke. Lewy body dementia is caused from protein deposits in the nerve cells, which prevents the brain from sending chemical signals.
Severe Parkinson's disease can cause dementia, which typically causes problems with reasoning and judgment, as well as increased irritability, paranoia, and depression. Roger?
For treatments, there are medications, but medication is not always prescribed depending upon the case. Sadly, medication is not the cure for dementia. Although dementia is not a fatal disease, when you are in the late stages of dementia, it is considered terminal. Dementia can actually also be brought on by heavy alcohol use. A study found that almost a third of early onset dementia can be attributed to alcohol.
Now, we aren't born knowing how to communicate with a person who has dementia, but we can learn. Improving your communication skills will help make caregiving less stressful and will likely improve the quality of your relationship with your loved one. Good communication skills will also enhance your ability to handle the difficult behavior you may encounter as you care for the person with a dementing illness.
Your thoughts or feelings are more strongly interpreted than your words. Set a positive mood by speaking to your loved one in a pleasant tone and a respectful manner. Use facial expressions, tone of voice, and physical touch to help convey your message and show your feelings of affection.
We are now going to talk about the ways that you can help someone with dementia. Get the person's attention. Limit distractions and noise. Turn off the radio or TV, close the curtains or shut the door, or move to a quieter surrounding. Before speaking, make sure you have their attention, address them by their name, identify yourself by name and relation, and use nonverbal cues and touch to help keep them focused. If they're seated, get down to their level and maintain eye contact.
State your message clearly. Use simple words and sentences. Speak slowly, distinctly, and in a reassuring tone. Refrain from raising your voice higher or louder. Instead, just pitch your voice lower. If they don't understand you the first time, use the same words and the same wording to repeat your message or question. If they still don't understand, wait a few minutes and rephrase the question. Use the names of people and places instead of pronouns. Don't be using he, she, or they, and don't use abbreviations.
Ask simple and answerable questions. Ask one question at a time. Those with yes or no answers will work best. Refrain from asking open-ended questions or giving too many choices. For example, ask, would you like to wear your white shirt or blue shirt? Better still, show them the choices. Visual prompts and cues also help clarify your question and can guide their response.
Listen with your eyes, ears, and heart. Be patient in waiting for your loved one's reply. If he or she is struggling for an answer, it's okay to suggest words. Watch for nonverbal cues and body language and respond appropriately. Always strive to listen for the meaning and feeling that underlie the words being used.
Break down activities into a series of steps. This makes many tasks much more manageable. You can encourage your loved one to do what they can, gently remind them of steps that they tend to forget, and assist with steps they're no longer able to accomplish on their own. Using visual clues like showing them with your hand and where to place dinner plates, things like that, can be very helpful.
When the going gets tough, distract and redirect. If your loved one becomes upset or agitated, try changing the subject or the environment. For example, ask them for help or suggest going for a walk. It is important to connect with the person on a feeling level before you redirect. You might say, I see you're feeling sad. I'm sorry you're upset. Let's go get something to eat.
Respond with affection and reassurance. People with dementia often feel confused, anxious, and unsure of themselves. Further, they often get reality confused and may recall things that never really occurred. Avoid trying to convince them that they are wrong. Stay focused on the feelings that they are demonstrating, which are real, and respond with verbal and physical expressions of comfort, support, and reassurance. Sometimes holding hands, touching, hugging, and praise will get the person to respond when all else fails.
Remember the good old days. Remembering the past is often a soothing and affirming activity. Many people with dementia might not remember what happened 45 minutes ago, but they can clearly recall their lives 45 years ago. Therefore, avoid asking questions that rely on short-term memory, such as asking the person what they had for lunch. Instead, try asking general questions about the person's distant past. This information is much more likely to be retained.
Absolutely. That is very, very true. In working with a lot of dementia and Alzheimer's patients in my past, this is a strategy that is often employed, as are many, many of these things that have been listed off here. We'll often work with individuals who may have been in a trade and ask for their help in a certain sense to measure railings around the unit, or offering them tools that would connect them to their past as well, to give them hands-on, meaningful, and purposeful tasks to allow them to live in their moment and relive those good old days. So that's certainly a very valid and applicable technique that can be used. If your father or grandfather, mother, daughter, whoever it happens to be, was a railroad conductor, facilitate that, live in their world with them, because to them, as James mentioned, what they're perceiving is real. There's no wrong answer to them. If they're not perceiving around them what's really happening, you have to step into their world and dance with them in that reality, because they don't see things as we do. In doing so, you have to also maintain your sense of humor and use it wherever possible, though not at the person's expense. People with dementia tend to retain their social skills and are usually delighted to laugh along with you.
Some of the greatest challenges of caring for a loved one with dementia are the personality and behavior changes that often occur. You can best meet these challenges by using creativity, flexibility, patience, and compassion. It also helps to not take things personally and maintain your sense of humor.
We cannot change the person. The person you are caring for has a brain disorder that shapes who they have become. When you try to control or change their behavior, you'll most likely be unsuccessful or be met with resistance. It's important to try to accommodate the behavior, not control the behavior. For example, if the person insists on sleeping on the floor, place a mattress on the floor and make them more comfortable. Remember that we can change our behavior or the physical environment. Changing our own behavior will often result in a change in our loved one's behavior.
Absolutely. Very good point, Sarah. The individual who I spoke of earlier in mentoring me in Alzheimer's and dementia, one of the books that he wrote was titled Dancing with Dementia, because that is literally what you're doing. That individual is taking the lead and guiding you through their process and how they're feeling and perceiving things. So it's important to take those cues and adapt your behavior to their behaviors. This is a perfect example, placing a mattress on the floor for an individual who doesn't like to get up into their bed. There may have been an experience in their past that is manifesting that. So really, really great tips there as well. Something important to keep in mind also is to check with your doctor. Behavior problems can often be manifesting themselves due to an underlying medical condition. Perhaps the person is in pain or experiencing an adverse side effect to a medication that they've been prescribed, I should say, I'm sorry. In some cases, with issues such as incontinence or hallucinations, there may be some medication or treatment that can assist in managing the problem as well.
We also have to remember that behavior does have a purpose. So people with dementia typically can't tell us what they want or what they need. So they might do something like take all the clothes out of the closet on a daily basis, for example. And we would wonder why the person is doing that. It's very likely that the person is fulfilling a need to be busy and productive. So always consider what the person might be trying to meet with their behavior, and where possible, try to accommodate that.
As well, we need to remember that behavior is triggered. It is important to understand that all behavior is triggered. It occurs for a reason. It might be something a person did or said that triggered a behavior, or it could be a change in the physical environment. The root to changing behavior is disrupting the patterns that we create. Try a different approach or try a different consequence.
Remember that what works today might not work tomorrow. The multiple factors that influence troubling behaviors in the natural progression of the disease process mean that the solutions that are effective today may need to be modified for tomorrow or may no longer work at all. The key to managing difficult behaviors is being creative and flexible in your strategies to address the given issue.
Absolutely, Sarah. Very good point. And this speaks to the importance of proper care planning for our residents in our long-term care facilities, where the individuals who are working with them on a daily basis and spending those hours and time, all that time with them, can share those details of what approaches work and what approaches do not work, as far as having them assist with anything that they're doing. Very important to keep them on mindful tasks. And the last point we like to make with regards to this is to get support from others. You know, you're not alone in this situation. There are many, many families across the country and in our local communities that are caring for people with dementia and dealing with these same situations. So contact your local area agency on aging, the local chapter of the Alzheimer's Association. Reach out to your local facilities as well, as they'll be able to relay you and connect you with some other important resources and program facilitators in your local communities to help you deal with your loved one who may be suffering from dementia, and hopefully have them provide support that will enable you to keep your loved one at home for as long as possible and help mitigate the risks that come along with this degenerative condition that is just so detrimental to some people. So I'd just like to thank my colleagues for all their contributions here. It was a really great conversation, some wonderful information, and be sure to stay tuned to our social media channels so that you can catch episode 4 in this mini series on mental health in support of Bell Let's Talk Day. Thanks very much, guys. This was really informative.